Andropause is a condition in which men have a drastic reduction in the availability of free and total testosterone levels. The dangers of andropause in men are quite significant. Number one, we believe that testosterone is a natural anti-inflammatory. And as men age, if they have low testosterone levels, which is quite common for most men past the age of 45, then their risk of inflammatory arthritis, inflammation associated with heart disease, high triglycerides, and certainly loss of muscle density, and certainly loss of sexual function. All of these really play a big role in premature aging in men in what we call andropause. I'm amazed at how many athletes have to retire from their careers prematurely because they had no clue of how to restore testosterone to natural levels without having to resort to anabolic synthetic steroids. In women, after they've had hysterectomy, once they've had their ovaries removed, oftentimes they're not aware, and even their doctor may not be aware, not only do they need the replacement of estrogen progesterone, but the ovaries are truly the site of testosterone production. So a woman who's lost her ability to maintain high natural testosterone levels may find herself increasing in body fat, increasing in cellulite, decline in libido, and various aspects that makes her to feel healthy and happy and sexy. I've talked to a number of doctors, and they've been measuring blood levels for testosterone and elevated abnormal forms of estrogen metabolites. And we're finding that not only do 40 and 50 and 60-year-olds have severely depressed testosterone levels and high abnormal metabolites of estrogen, but even some of the younger people, aged 20 to 25, where you normally would think would have the optimum levels, if you simply look at the people, the young men who have abnormal breast tissue development, they're higher than their ideal body weight, they seem to be moody or depressed, not quite as physically muscular as they should be, or interested in the aspects of sexual interest and the emotional aspects. So I went on to study herbs, specifically phytochemical herbs that had actions on helping to attach to sex hormone binding globulin and thereby releasing more bioavailable or active free testosterone into the bloodstream and into the tissues. This showed to be very effective in my clients, and I then went on to put women on similar types of herbal combinations, and we also saw a nice increase in bioavailable or that is free active forms of testosterone in the tissues and in the bloodstream. I decided to also measure the estrogen levels in the presence of very important cruciferous vegetable extracts called diindolylmethane, abbreviated as DIM, and indole-3-carbinol. And we also noticed a nice reduction in the harmful forms of estrogen, which are types of estrone, 16-alpha-hydroxyestrone. And we also noticed an increase in the good type of estrogen, 2-hydroxyestrone. All that went on to say that as we help people with these phytochemicals from natural plant derivatives to clear these bad estrogens, while at the same time we were able to increase the free and bioavailable active form of testosterone, we got the best results. Individuals reported increased muscle density, reduction in body fat, improvement in mood, and certainly improvement in libido and intimate function. We believe that testosterone itself is probably one of the most important anti-aging single agents when we talk about a variety of hormone levels, and certainly testosterone from Testrovita is one of the keys to quality of life. Testrovita works because it's a very potent combination of herbs and certain minerals. In the case of boron, boron's been shown to increase the natural production of testosterone. We also use tribulus terrestris, which increases luteinizing hormone, and that helps the body to produce more of its own testosterone. And furthermore, we've used very concentrated forms of herbs, such as long jack and avena sativa, and the use of nettles, which is a very important combination to help to bind with sex hormone binding globulin, thereby releasing more free testosterone into the bloodstream and into the tissues. I'd like you to try Testrovita. It works very well. We've monitored hundreds of people, and over the last 30 years, we've seen rather profound effects, to the point where Testrovita itself is now the most effective concentrated product on the market that I've ever seen, and I think you'll agree.